Hi, welcome to MedEdge MEA podcast. Today we have a special guest with us, Dr. Ramadan Alblooshi. He is the advisor for Director General as well as he is the acting director for Public Health Protection Department of DHA. Welcome to our show, Doctor. In our podcast today, we are going to discuss about HFS 2024, which is Healthcare Future Summit, which is the first ever vaccination and infectious diseases summit going to be held in Dubai World Trade Center on October 29th and 30th. Coming back to Dr. Ramadan. So you are seen as one of the healthcare leaders in the UAE country as a whole. When we speak about vaccination, there are a lot of things, some awareness, some misconceptions about vaccination, that too after the COVID. How important it is for an individual to have this particular knowledge about the vaccination. So what is your perspective about the importance of vaccination today?
I think the issue about vaccination has broadly been changed after the pandemic. Some believers became non-believers and non-believers became believers. But the issue is not about those. The issue basically is longer history of vaccination history, what happened before. The history of vaccination is very simple, is protection for the public health, which means protection of the individual from certain disease. As we are aware that the mutations of the viruses and bacteria increases over the time, as we spread over the continent, as we travel more, as we mix with different nations and nationalities, we definitely are higher, we are a possibility of having different disease carried over to another country is a high possibility. So with vaccination is another way to reduce this burden of disease on the people, to reduce the impact, and of course to reduce any illness will be happening to this. So vaccination is not something new. We are not predicting something new, we're only trying to have better technologies to administer those vaccines. A lot of studies has been carried over, a lot of research has been happening to prove that these vaccines are necessity for certain people at certain ages and certain group. We also encourage from today saying that vaccine is not about before and after. It is continuity of the life. It is ensuring that the quality of life changes over time for a better health.
When you spoke about different nationalities, we know that Dubai whole is home for more than 200 plus nationals. When it comes to the vaccination rates, what are the DHA's plans, strategies, and what are the implementation level you are looking into in order to increase this vaccination rate?
When we talk about the vaccination, we go to the bigger cause or bigger issue, which is equity. So public health is about equity, which is basically that every individual living in Dubai, whether he's citizen, whether he's a tourist, whether he's visitor, that has the right to get vaccinated when time comes. So this is the way Dubai government works, and this is the way United Arab Emirates how it works with the nation. So basically, we don't look at any nationality. We look at what is the need for the vaccine for them and how we can give it to them in the right time, right place, and of course the right vaccine.
You also spoke about technology now. We know that this era is everything about technology. All the industries today are leveraging the use of technology, be it the aviation industry or even the healthcare industry. At large, all the industries are depending upon the technology. So how does DHA leverages these technologies in order to monitor the vaccination rates? Is there any health app, digital health app or website, or how you are leveraging the technology for the cause of increasing these vaccinations?
I consider myself as a UAE national one of the luckiest countries in the globe that our leaders, our government is encouraging technology in healthcare. So for example, we started from normal individual application to blockchain to artificial intelligence and so on. So by implementing those, I think we are having a lot of encouragement, a lot of support from the government to start buying those technologies or implementing them to serve the society. And it is very evident nowadays that a lot of technology has been used in applications and websites and reaching out as well, and even using some AI technologies to identify some sectors or some certain disease, which is already happening in the country.
During these vaccination drives, what DHA is maintaining, is there any partnerships you are involved in with any private entity in order to increase the reach of the awareness as well as the vaccination rates?
A simple rule: vaccination will never succeed unless you have a partnership, because you are targeting a mass number of people. You are not targeting individuals. You are targeting a population. So when it comes to population health and comes to vaccination, if you don't have a successful partnership with, especially with the private, you will never succeed. Second thing is that the government of Dubai is always encouraging to have this partnership with the private sector to make sure that the reach out is more, to make sure that the people category who are visiting the private, they get exposed to the vaccination. So of course, partnership is one of the most important pillars of succeeding vaccination campaigns.
So whenever there is a campaign, we have seen there will be a lot of challenges in order to accomplish what we aim for. So how does your communication strategy makes a different kind of aura in order to reach the audience which you are looking for?
Audience in Dubai, as you said, there's more than 200 nationalities. So you can't go a campaign doing an Arabic campaign to an English campaign speaking nationality or different languages. So what we do basically, there's certain strategies we play a role in the year to see which area we go, what is our population target, which language you have to reach out, what sort of beliefs they have, you have to tackle them, how to even teach them the proper way, how to even show them what is the benefit of the vaccine. So yes, when we do a campaign, there's a full plan about it. It's not basically taking our stuff and going there and vaccinating people. There is always a head plan, where we are going, what we are achieving, what is our target, and where we are going.
So coming back to the Healthcare Future Summit 2024, you are the chairperson for the entire summit. So we wanted to know what are the overview of HFS 2024.
Our goal is go from local to global. So Dubai is always aiming to spread the good news, spread the good behaviors, spread the good studies across the globe. So I think today we are shedding light on the first global vaccination conference and exhibition to have this nature of bringing well-known speakers across the globe, sharing those experiences with us, showing the latest technologies, and of course involving research and mitigation about it to see what is happening across the continent. We are not looking in Dubai region, we are not looking in the Middle East. Our aim is to reach globally in a very short time. At the same time, to adopt and adapt all those technologies across the region, also to transfer our expertise to different continents and different places of the globe.
So how will be the key focused area? Which area you are looking into more in order to make this summit successful?
One of the main important areas is research and education. We are very focusing on what are the latest technologies about research. Second thing is innovation. Third thing is reaching out and supply chain and demand. And the last thing is health economy, which is very important aspect nowadays. We need to address those main components in this conference. Of course, along all of these tracks will be always a medical discussion about different vaccines and approach and so on.
What kind of participants and stakeholders you are looking into or will be participating in the event?
Of course, the participation is different because the target is different. We are targeting doctors, we are targeting normal individual citizens, we are targeting supply chain and companies, we are targeting pharmaceuticals. So each one of those elements, they have different aspects, different topics to talk about. And we also made sure that the speakers who are coming will be addressing those issues and those topics along those 3 days.
So is there any partnership, expected to be emerged from this summit?
Yes, of course. There are partnership and there are messages should come from this conference. The partnership, which is looking is a long term, is not a first year partnership with them, because we'd like to work with them in research and we like to work with them in technology. So the partnership is being there. And we are very lucky to have a long list of partnership with different entities, whether it's locally or globally. Now, the outcomes of this conference is also very important. We need to give a message to the whole globe. One of them is to regain the trust of vaccine. Second thing is to see what are the main technologies which will reach out to different categories. Third thing is that we need to shed light on research and education, which is the future of vaccination.
What is the future of vaccination and healthcare in Dubai?
I think what we are aiming, as I said in the beginning, is to reach globally, to be one of the well-known centers globally to learn from public health. We want to have the first and best center for public health. We would like to be a state-of-art of public health. At the same time, we'll be one of the global destinations to serve the public health societies.
One final message that you can give to the participants who will be coming to HFS in 2024.
My message that this conference is global, it's not local. You will have the chance to meet one of the best speakers globally. You have the chance to meet the best doctors, the best knowledgeable, experienced people globally. So I will really urge you to attend and gain knowledge. And we in Dubai welcomes you as a destination, medicine and tourism.